Varicose veins are an extremely common problem for both men and women. In fact, more than 40% of the population suffers from symptomatic or problem varicose veins. Until recently, the most effective way to relieve the problem was a painful operation known as vein stripping. But now, as Regina ECKEL reports, doctors at Riverside Methodist Hospital have a quick and virtually painless way to eliminate varicose veins.
This is the laser we use for the procedure. We actually insert this inside of the vein that has faulty valves and then turn on the laser fiber, and then the heat from the laser contracts the vein wall, shrinking the vein and eliminating the problem.
Thanks to advancements in laser technology, painful, unsightly varicose veins may soon be a thing of the past for millions of Americans, including VICKI BLACKBURN of Upper Arlington.
Was that I had a lot of aching in the leg, and with me on my feet all the time, it would be very uncomfortable at night.
VICKI happened to be sitting in the doctor's office recently for something completely different when she read a little blurb in a magazine about this endovenous laser treatment, and she was immediately intrigued.
I had no idea if they did it in Columbus, but I have friends at Riverside, so I called the radiology department, asked them about it. Sure enough, the procedure is being done.
Varicose veins result from the malfunction of one-way valves designed to keep the blood from backflowing on its uphill path back to the heart. When the valves fail to function properly, it causes pooling of blood and bulging, twisted varicose veins.
First thing I'm going to do is just inject a little bit of X-ray dye.
Using ultrasound to guide his laser, Dr. McGraw collapses the vein, which turns into harmless scar tissue. So how does the blood then get back to the heart?
There are two major vein systems in the leg. There's the deep venous system, and then there's the superficial venous system, which is closer to the skin. And then that's the vein that we treat, mainly the saphenous vein. By eliminating the saphenous vein, the blood then gets diverted into the deeper system, which is a much more effective way for blood to get out of the leg.
The laser procedure for varicose veins typically takes less than an hour, is virtually painless, and perhaps best of all, requires no downtime for the patient.
I walked around the building after the procedure for about a half an hour, which he has you do, to make sure everything's flowing, and I did fine with that. Came home, cleaned house, went back to work the next day. This procedure was just unbelievable.
Riverside was the first Central Ohio hospital to offer this procedure, which is proven in clinical trials to be 97% effective. Currently, it's covered by some, but not all health insurance carriers.